Hi friends, good evening. I'm Dr. Ashutosh Gupta and I practice this fetal medicine. So this is a very sort of an intriguing branch. So meaning thereby that looking around for the fetus is always so interesting. So every now and then we see something which is out of the box and which we would have never expected. So today, what we were doing is this that we were just doing the lady had come for a fetal echocardiography and just we were doing the echocardiography, right? And then, but then this baby had not, I had not seen this baby in the previous scans. So I was just looking around for the baby and what is happening. So I got stuck with one small finding, and then probably that really intrigued me. And then if we dig deep into the finding, and then we identified that it is a V-shaped transverse colon, right? So which is sort of in a rare finding, and then we try to look around what exactly it is all about. So let us first see these videos, and then probably we'll talk about it. This is the lady that we are seeing at 26 weeks, and the echo is normal. But you try to look around, so this is a V shape, a kite shaped transverse colon, right? So it is going exactly up to the anterior abdominal wall, and then here it is. So it is the proximal part of the V, and if you look closely, so this is the V, which is there, and then we can even look around for the fibrous band. We can see both the proximal and the distal part of the transverse colon, and the baby was moving a lot, and so was the gut, but I would try to focus it. And so this is that was the gallbladder, right? And then this is the proximal part of the V, right? And then the distal, and then the distal part of the V. And I would show it in a better way. So this is a transverse colon. We can identify the longitudinal band going to the mesenteric border and to the retroperitoneum. So this goes up to the anterior abdominal wall, and just adjacent to the gallbladder. And this, yeah, so this is the fibrous, so this is the fibrous band. Adjacent to this fibrous band, what we can see both the proximal and the distal part of the V, which is a transverse colon. We can see even the meconium and both the sort of in segments, both in the proximal and the distal, right? So both the proximal and the distal, so meaning thereby that it is not obstructive antenatally, and there is a passage of the meconium both from the proximal side into the distal, right? And then this is the V shape. So this is the fibrous band longitudinal, and then alongside we are having this V-shaped transverse colon, right? So this is the, so let me show it again. So this is the distal part of the V, and then the fibrous band, and then the proximal part. So this is the V-shaped transverse colon, right? And the band, and then the band, and this is the gallbladder adjacent, right? So that is what it is. So it is not an acute obstruction. There is no dilatation, and but then it is going. But then it is going up to the anterior abdominal wall, just close to the gallbladder, right? So that is what. So that is how it is, right? So we can see both the limbs of the V. We can see both the limbs of the V, and then this is a so and we try to look around. So it is a persistent finding, and it is a fixed position. We could identify both of them. And normally, what happens is that the mesocolon is there, which attached to the free mesentery, and but it is a physiological herniation in the rotation which happens normally, and therefore this is a fibrous band, and therefore this leads to this V-shaped configuration, and therefore this failure of this regression of this peritoneal attachment leads to this both the proximal and the distal or the V-shaped part, and so this becomes a persistent V. It is a fixed position, and but bowel integrity is all maintained, and then the functional part is also maintained, right? So this is the schematic diagram that how does it behaves and all those stuff. This was a very interesting finding that we could identify a V-shaped transverse colon first, and we could identify that there is no dilatation in both the proximal and the distal part of the transverse colon. Third, we could identify that meconium has passed from the proximal part into the distal, so meaning thereby that there is no sort of an obstruction. As a matter of fact, since there is no obstruction in the passage of meconium, so we don't expect the bowel to get dilated and all those stuff, right? And I believe that this is amniotic fluid was all normal. I believe that this is not going to create any trouble sentimental to the baby, but eventually we'll keep the baby under follow-up so as to see for the proximal dilatation of the bowel of the transverse colon, right? And eventually also that the baby in the immediate postnatal period would be uneventful. So probably since the passage of the meconium is there, when the baby during the 6 months of the period, the baby would be breastfed, so that would be only the liquid diet, and therefore this can also pass on through. So I expect to this sort of an V-shaped transverse colon to behave like an SAIO. It is subacute intestinal obstruction that might happen at 6 months, post 6 months or 7 months and 9 months, when the baby would be offered um, uh, a complete food. So when the baby would be, which is called as anprashan, when which the baby is being subjected to the whole food, and therefore that might lead to this subacute intestinal obstruction. So before than that, I believe that it would be absolutely great, right? So that is how it is. So fetal medicine is all intriguing. So that is how it is. So we stumbled upon this V shape sort of a transverse colon, and it identified to be a sort of a normal variant. Thank you very much for your patient listening.